Hi and welcome to Guitar Ergonomics Conversations. If there is one video that I really want you to watch on my YouTube channel, it is this one here. The video that you're going to watch after this short introduction is a conversation with hand surgeon Mark Phillips, where we are discussing the concept of no pain, no gain, and why this is a really full concept if you want to learn to play the guitar properly and be a musician for that matter. No pain, no gain is this idea that you just have to press through the pain barrier when you are learning something on the guitar, and that doesn't matter. As long as you're just pressing on and on and on, you will learn it in the end. The reason why this is a really, really bad idea is because, as the saying goes, no pain, no gain. You will experience a lot of pain in your hands and in your arm, shoulder, and back. And you shouldn't do that when you're playing an instrument, and particularly not the guitar, because on the guitar, the vast majority of our movements are actually unnatural. And that means they have to be learned and studied very, very carefully. So what I would advise you to do is when you're practicing is take it easy. Don't practice for too long. A long practice session for me, for example, is just a couple of minutes, and then I would take a break and get away from the guitar and think about what I was trying to learn and how well I did it. What you also need to think about is when you are playing and when you are practicing, you need to look after your body, and you need to have a body awareness where you're noticing everything that happens in your head, your neck, your shoulder, your back, and of course in your arms and hands. So if you are feeling any kind of pain when you are playing, that's really a sign from your body that tells you it's time to stop and take a break. And preferably you shouldn't do that at all. There shouldn't be any kind of pain when you are playing. There are some other videos on my channel that you can look at, for example, shadow practicing, visualization, which will help you to play without pain. So these are tips and ideas about how you can play without actually having any pain. Now, one of the reasons that people are using the concept of no pain, no gain is because they knowingly or unknowingly are an end gainer. An end gainer is somebody who are only thinking about the end result and not about the journey to get there. And that may be a reason for why they are trying to push through the pain barrier when they are learning to play the guitar. If you actually enjoy the journey of learning something new step by step and let it take the time that it takes to learn it properly, you will have a much better experience. And I guarantee you, you will also get a much better result in the end, but without pain. I really hope you're going to enjoy this video and conversation with hand surgeon Mark Phillips and I, where we discuss the concept of no pain, no gain, and why it's an absolute no-go when you're learning to play the guitar. Thank you very much for watching.
So good to see you, Paul. How are you?
Yeah. Hi, Mark. I'm really well. Good to see you. And I thought today we should talk about the concept of no pain, no gain.
Yeah.
Because in the world of the guitar and guitarists, this is a big issue where people promote this kind of philosophy and it often leads to injury. So I was wondering whether I could start by asking you some questions about that.
Yeah, sure, of course.
What do you think about the whole concept of no pain, no gain?
Well, you're not the first person that's said this to me. I mean, I work with other musicians as well, pedagogues who talk about it. It's very commonplace, and you basically brought it to my attention, just how common it is that people will carry on playing in the way that sports people think that if they can get stronger by working through that pain barrier. It seems to be ridiculous, actually. It doesn't work in music. And playing comfortably is essential as far as sound quality, as far as I can see, as well as staying away from injury. It's a very bad concept. Yeah, I completely agree with you.
That sounds really great. I would certainly agree with that. The other thing I wanted to ask you about is that if a guitarist continues down this road, no pain, no gain, and ignores those pain signals and just keep playing through the pain barrier, as you just said, what is the likelihood that he will come to end up with a hand surgeon, and what kind of symptoms or operations will he need to have?
Yeah, well, of course, I don't know all of those people who push themselves through the pain barrier and don't come to see me, but I do definitely see the people who have done that and end up seeing me. And the commonest thing that I see in my clinic is tendonitis. And of course, that's what people will get, because tendonitis is essentially a micro tearing in your tendons. The vast majority of the tendon is intact, but a few fibers will tear, and then people will feel that pain, and that they'll get inflamed for a long period of time. Very often with tendons, when they're inflamed, they jam in tunnels. They don't run through tunnels very smoothly, and that creates a vicious cycle of perpetuation. Tendons take ages to heal once they've been injured like that, often a couple of months. Often tendons can feel comfortable for a few weeks, but they aren't really healed. And so when people start using it again, they will have pain very quickly because the tendon isn't fully repaired. And it's quite difficult to get out of that repetitive cycle. A lot of people who rest with tendonitis find that whilst they may be comfortable, and this doesn't always happen, they may be comfortable for a period of time while they're resting, they then go back to playing again, and there's a step change in how much they're playing. And they often try to catch up for all the practice. It's like sport. They try to catch up for all the training they haven't done. And that step change is catastrophic because the tendon fails immediately. So they've got to do a graduated return if they've had a rest. And if that doesn't work, and it's not a great strategy, I don't recommend resting. I recommend people going down to a level where they're comfortable playing, and then gradually building up, doing 15 minutes and having a rest. And then the next day or 2 days later, if they've got away with it the following day and they haven't got increased pain the following day, then just going up to the next level, maybe an extra 5 minutes, and just checking to see if they can do that. Because it's a delayed feedback loop, unfortunately. So when the tendons are injured, they tend to swell overnight, they're stiffer the next day, and it's only the next day, not the same day, that you find out that you've done too much. And it's very frustrating for people. They really suffer trying to come out of this. So, and the hierarchy of treatment that people will go through with me will be adaptations to technique, splinting, strapping, and then perhaps steroid injections after a few investigations like ultrasound or MRI, and then hand therapy, physiotherapy, other treatments, including ultrasound, stretching, gradual strengthening programs as they get stronger. And ultimately, there are some patients who end up having surgery too. Or the patients who have steroids sometimes will have steroid and be okay for 6 months, and then 6 months later it'll come back again if you haven't treated the cause. If the behavior is much the same, it'll come back again, and then they'll have another steroid. And I call those people my steroid junkies. And I'm creating a steroid junkie as I give them the first dose. Yeah, so it's all pretty grim, Paul, and we'd be very keen that people don't get into this horrible trap. Yeah.
Interesting stuff. I think what was really interesting, and I think what many guitar players out there would be interested in knowing, is exactly what is the hierarchy, where do we start? And if I don't change my technique, where can it end in worst case scenario, which you just explained?
Yeah. So in surgery, we often have these hierarchies, and surgery is very much a last resort, obviously, and the degree of invasiveness, that's what we call putting sharp things through people's skin, like needles or knives, that degree of invasiveness, or perhaps wearing a splint for a long period of time. It's all about sort of catching these things early, and the easiest thing you can do is look critically at the technique and avoidance of creating the problem in the first place. Yeah, and that's, and you're an Alexander technique teacher. It's all those principles as well as all the other guitar principles that you teach regularly.
Yes, it's very much, we come from the same side of the pond there, because you have to change your technique if you are using no pain, no gain, because at the end of the day, it's just not going to work, and you will have to relearn and redo things and work in a completely different way, a much more holistic way with your instrument.
So can I ask you a couple of questions then, Paul?
Yeah, sure.
So you suggested this is quite common. How common is this? I mean, you brought it to my attention.
Yeah. So if I look at the guitar players that I've seen for the last 20 years, 90% of them has this to some kind of degree. And this that's of course
no pain, no gain. This is how they ended up in this situation.
It is, and I think that the tragic thing about it is either they are aware of it and they have sort of used this concept because that's what they've been told to do, or they think that's very cool, or more tragically, actually, they're not even aware of it. They just do it without actually being consciously aware of the pain signal that they're receiving. So they're not responding to the feedback. They just think, if I practice more, I'll get better. It doesn't matter, it's hurting.
Yeah. And what sort of patterns of injury do you see typically?
So if we are talking about the hands, first of all, so in the left hand, if that's the hand that is on the fretboard, there's a lot of pain around the base of the thumb because of the grabbing and the pushing, and of course around the wrist here. Sometimes it goes up through the arm and up to the shoulder as well, but it's very localized around here. And it ends then with that they simply just don't have freedom of movement, and it becomes worse and worse. And suddenly they can't do certain things. They may not be able to bend their strings properly as an electric guitarist, and they don't have the flexibility, for example, as a classical guitarist might need in their left hand. And I think for the right hand, it's more, particularly if you're playing with a plectrum and you're holding a plectrum and you get very stiff in your hand because you have to do very, very fast movement, and you then start seeing pain on both sides of the hand and the wrist and coming up through the forearm. And the result again is lack of movement, constant pain when they are playing. If they don't have a very free moving hand, if they are doing finger picking, so the fingers goes into the string attacker, out again, if they don't have that technique, the fingers start getting stuck inside because they are so painful that they can't actually release them out again. And then they can't play their arpeggios in a very rhythmic and precise pattern, which of course is a bit of a catastrophe. So it's that sort of thing, and that can of course develop up into the arms and the shoulders and so on. But it's very often located in the hands.
Yeah, and that's obviously what I see because I'm a hand and wrist surgeon. So, and I find this a very difficult condition to treat once it's well established. If you catch them early, or indeed if you see them when they've got quite established tendonitis and other problems related to their playing, can you tell me what your sort of timeline on recovery is, and can you help them?
Yes, I can. The timeline is a minimum of 3 months. If you can do it in 3 months, you've done it very, very quickly. And that would be typical guitarist who is really quick to learn and is open to learn and wants to learn and wants to change. Otherwise, I would say it can easily take between 6 months to a year, particularly if you've been playing for a long time and has totally ingrown habits, because you have to go back to square one and start all over again with tiny, small movements and slow tempos and practice just 1-2 minutes at a time. It's a long, long journey, unfortunately.
Yeah, it is. And certainly when they come to my clinic, quite a lot of people turn around quite quickly when we put the right treatments in place, but quite a few patients will end up with a much longer timeline, and some people were really struggling at 1 year or 2 years. Happily, I don't see many people who have 5-year or 10-year history of tendonitis, and usually people have managed to find a solution by then. But it is often a very protracted 1 or 2 year, but sometimes a self-limiting condition. It can turn around and just settle down, and it rarely comes back again when it's been cured, or people do all the right things to make sure they never get that again once they're over it. But yeah, it's a devil of a condition once it's established. Yeah.
I think for me, what's important really to do with the guitarist is to show them that there are different techniques. So, for example, we just take one example: the left hand, which is the one that's on the fretboard. If you grab the fretboard a lot with your thumb, you will develop pain because the guitar neck is very hard. It's made of wood. Whereas if you use the muscles in your shoulders to actually keep your hand in place and just let the thumb relax against the neck and just follow the hand as a shadow, you will avoid this kind of pain. And only use the thumb for some bar chords and bending strings, obviously, but then relax it again. And it's those kind of holistic techniques that really can help a guitarist to play without pain and have a complete freedom of movement on the guitar.
Yeah, a lot of people are frightened to start looking at changing their techniques because they've had the same technique for such a long time and they're worried about changing it. And actually, what I often find myself telling people is that what we're doing here is, you now have a clinical condition. I'm not saying that your technique necessarily caused it, or you might have well got away with it for a very much longer time, playing the way that you do. But now that you've got this clinical problem, you need to find a workaround to allow that problem to heal. And then you might find that your technique is better as a result of the minor adjustments that you then make. And they can often be very minor adjustments too.
Yeah, sometimes it's just a few bits that needs to be changed in the left and right hand. And the other thing that I think we need to think about is something that's really important. That is, what's our mental approach to practice? Right. So what do you think about before you practice, when you're practicing, and afterward? How do you reflect and how do you measure your progress? But that whole thinking process about what is it like being a musician, a guitarist, and which can create tension in you, performance anxiety and so on. And it's really important to look at those things as well. So it becomes totally holistic approach to how you work as a guitarist and as a musician, of course.